The Nurse Internship is an 8-week-long program. It's for anyone in nursing school that will be going in as a senior in the fall of the following year. The Nurse Internship Program is designed to give hands-on experience for those from school to their profession.
My name is Cameron Warford. I am a registered nurse in the Progressive Care Unit at Blessing Hospital. I like the pace. I've never had a job where it's 7 in the morning, next thing you look up, it's 7 and out. You're busy, it's good pace, good excitement. I interned in Progressive Care for my internship, so I ended up working in the same department I did my internship in. I kind of got to see the flow of the department, got to see a lot of the kind of patients that they see on a day-to-day basis. It showed you what the real job was. Like, school is great, you gotta learn the book stuff, you gotta have the knowledge obviously, but actually getting your feet wet and seeing what a nurse's real day is like, you don't get that in school. Just a nice stepping stone in between the student to professional role.
My name is Amy Hare, and I'm currently a registered nurse in the emergency department. My internship prepared me for success by exposing me to the place that I would work after graduation. It allowed me to get to know staff on the unit. It allowed me to actually see what a shift looked like in the ER and if that's something I actually wanted to do after graduation. It also just exposed me to what nursing is and getting practice with IV insertion, Foley catheters, giving medications or watching an RN give medications and what that looks like. I think students should take part in this program just to help practice for when they are an RN. Even if they're interning in an area that they don't have interest in necessarily, they still get exposure to assessing, to being around patients, to being comfortable with different medications. I know you're able to do like IV insertions, and that helped me so much, being able to put an IV in when I graduated and was a new grad. I think it also helps you build relationships with nurses on the unit or your preceptor. It helps build that good relationship, someone that can be there and help you and who was once a new nurse too and can help you. If you're thinking about doing the internship, I would encourage you to do it. If nothing else, you will figure out a unit or specialty that you don't like or that you do like that you didn't think you would like. But if nothing else, like your nursing skills that you will learn during your internship or what you need for any job.
My name is Maria McPherson, and I am a registered nurse in the intensive care unit. I did my internship on the progressive care unit. It was a wonderful experience. And then I did transition and start on progressive care as well, and have remained there for the last 2.5 years, and then just transitioned over to the intensive care unit. It really helped to show me the flow of the floor and the patient population. It helped with critical thinking, time management, just everything to help get me prepared for the nursing role. It helped me see more than what I would see just in clinicals and such. I learned endless information. I learned how to set up my day and how to go through, the different tasks, but also have the critical thinking and really just how to get the feel of a day as a nurse and not just in school. You do a lot more of the hands-on with the internship. It kind of helps you to navigate where you want to start. You might do your internship somewhere and decide, this isn't really where I want to start. Or it might tell you this is exactly where I'm meant to go and what I want to do. You think that in school you have to be perfect and you have to know every little detail, and it's not always going to be like that. Sometimes the answer is genuinely going to be you don't know for that moment, but you're always going to dig deeper, do the critical thinking, do the things that you don't always get to think about in school because you're so focused on the material and the content and that kind of thing. But as you go into the internship and you really see real life on the floor, you realize how much of a difference that you're truly making in the lives of these patients and how it's not always going to be textbook perfect. Overall, it's just a very good experience to get the real feel for the floor.
Apply today for the Nurse Internship Program on the Blessing Health System website.